Good morning, everyone. Welcome to our fantastic session looking at Future Healthy Countdown 2030. I want to let you know that this session will be recorded, so get ready and you'll be able to hear the session at the end of the time. Before we get going, I'd like to acknowledge the traditional custodians of the lands on which we work. We pay our respects to elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people. ARACY treasures the rich and diverse cultures and customs of First Nations people, the valued knowledge holders, leaders and partners in creating the conditions for all our children to thrive. And today I'm on Gadigal land of the Eora Nation. We've got a great range of speakers today and they're going to introduce themselves as we go along. You'll have an opportunity to have a Q&A, so please put your questions into the chat. And as I mentioned, we are recording this and it will be available for you via email at the end of the session. Our focus today is sharing our progress report on the Future Healthy Countdown 2030 and how we can work together to drive advocacy and accountability for and with children and young people about their well-being. ARACY is proud to support this initiative, which brings young people together with researchers and sector leaders in a genuine intergenerational collaboration, connecting evidence, experience, and ideas to drive better outcomes for children and young people. And now I'll hand over to Professor Anne Peters, Vic Health CEO, to introduce the countdown. Over to you, Anne.
Thanks so much, Prue, and good morning, everyone. I'd also like to begin by acknowledging the traditional owners of the lands we're meeting on today, and for me that's the lands of the Wurundjeri Woi-wurrung people of the Kulin Nation in Melbourne, and I pay my respects to their elders past and present, and I'd like to extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. So I'm really privileged to be speaking today. When we talk about the Future Healthy Countdown, we're talking about self-determination in practice, peoples and communities having a real say over the conditions that shape their lives. And that principle is really at the heart of prevention and health promotion. So Vic Health is really proud to be a founding partner of the Future Healthy Countdown 2030, working alongside ARACY and the Murdoch Children's Research Institute. The countdown was established to do something Australia's never done before, to track year on year the extent to which children and young people are thriving, and then to hold ourselves accountable when they're not. So we've been using ARACY's NEST framework, which captures 7 domains of child and health wellbeing. And this countdown brings scientific evidence and lived experience together to measure what matters most. It's a targeted national framework that turns data into direction, showing how policy and practice can better support future generations to thrive. Now in its 3rd year, it's really exciting that today marks this major milestone, the launch of our very first progress report. So as you can see on this slide, when we started in 2023, our focus was on building the foundation. That first supplement in the Medical Journal of Australia outlined the framework for the countdown and set out the 7 domains that we would track through 2030. We invited experts in each domain to describe the realities facing Australian children and young people, from education and participation through identity, safety and the environment. Our goal was really clear: to create a national blueprint for policy environments that deliver health and wellbeing for every child and young person in Australia. Next slide, thanks. In 2024, we took a deep dive into the domain of participation because for young people, feeling heard and having a voice are critical determinants of wellbeing. That work produced 5 research articles and a consensus statement developed with more than 50 young leaders, clinicians, policy and research experts, and they worked collectively to identify 22 measures and 8 policy actions to drive change. The actions are really important because they're practical, they're evidence-based, and they address child poverty and school funding to create environments free from the marketing of harmful products. The work really helped bridge the gap between public sentiment and policy decisions and showed how strong the community mandate is for change. Next slide, thanks. So this year, we take another big step forward. The 2025 Medical Journal of Australia supplement includes our first progress report, tracking the 22 core outcome measures and 8 policy actions we committed to, along with a deep dive into learning and employment pathways. because we all know that education and meaningful work aren't just economic issues. They shape mental health, social connection, and lifelong well-being. This work shows that while Australia has the tools to help every child thrive, many outcomes have stalled or gone backwards. There is good news, which is that the solutions are within our grasp and that they're informed by evidence and community wisdom. At Vic Health, we believe that prevention begins with belonging, and the Future Healthy Countdown is helping us build a shared language for action across research, policy, and community. By tracking what matters, we know we can focus our efforts where they count, by ensuring that every young person in Australia is valued, loved, safe, healthy, and ready to contribute to a sustainable future. So thanks to everyone who's helped bring this countdown to life, particularly our research partners at ARACY and the MCRI and the Medical Journal of Australia, and the many, many young people and experts whose insights continue to guide us. I'm really pleased to be part of this presentation series today, and now I'm going to hand over to Angelika Ojina-Kapsalaks from the Murdoch Children's Research Institute, who's going to walk us through the findings from this year's progress report. Thank you.
Thank you so much, Anna, for painting a picture of where we are today. And it's really exciting to be launching this amazing report. And before I deep dive into the results of this report, I'd love to specifically thank and call out Georgie Freiberg, who's the lead author of this report, who's done so much to making this come to life and making it possible that we're here today to paint this picture, but to also thank the whole team of the 23 authors who are part of this progress report, as well as the other authors who are part of this supplement as well, deep diving into learning and employment pathways. So as Anna has painted for us, when the countdown started, it wasn't only just to highlight a problem. We really wanted to offer pathways forward, solutions, often which sit outside of health portfolios, as many of you on the call would know. As such, this is where the inaugural Future Healthy Countdown Progress Report comes in. So it aims to spotlight the successes and areas where we fall short, but improve young people's lives, but also strengthen the word that we all know is fundamental to change, and that word is accountability. In this supplement, the vision of the 2024 consensus statement finally comes to life, and where we report on the 22 outcome measures across the seven Future Healthy Countdown domains, along with tracking progress across these 22 high-level indicators of progress. We're also calling for 8 policy actions in terms of implementing progress and change. And we know that these policy actions would make a real difference to children and young people's lives, whilst setting a strong foundation for future generations. And I'll go into those in a moment. But the progress report complements the growing efforts that I know many here on this call are trying to achieve, and that is shifting the needle on the health and well-being of children and young people. And as you can see briefly here, I'm going to get into this pretty picture that's on the screen. We've tried to really develop a set of indicators or measures that are wide enough, wide-ranging, but also light intentionally. And we hope that this high-profile, authoritative and permanent tracker of well-being for children and young people offers you as organisations or individuals some tools further for your own policy efforts and advocacy. So what is the picture for 2025? As you can see here, this is where we're tracking for children and young people's well-being as we speak. And our report assessed progress across against a 2023 baseline. So that's actually when the countdown began, using the most recent national survey and administrative data that's available. And of the 22 high-level measures, the new data was available on 15 of 6 of the domains that we have, yet only one, which is voter enrolment rates, which you can see in the orange box, shows progress in the right direction. 3 of our measures show movement in the wrong direction. That's material deprivation, civics proficiency, and government subsidies for fossil fuel industries. 3 measures show mixed progress, and 8 show negligible progress. The healthy domain, which is in the orange section, has a circle that's got a black outline, which shows that this particular domain is affected by a lack of regular, timely data. And the most recent population level data on children's mental health is over a decade old. And I know there's been a bit of movement there on changing that, but we still have a long way to go to show the full picture of what the healthy domain looks like for children and young people. Of the 22 measures that we do have, only 7 have clearly defined national targets, but only 1 was on track for meaningful improvement by 2030, and that again is voter enrollment rates. The thing is with this picture, and I feel like many on the call would acknowledge this too, that this is nothing new to all of us. They highlight what we've known for over a decade, that children and young people's health and well-being is getting worse or stagnating. And in some areas, we simply aren't even actually tracking progress to begin with. So although this image on the screen shows a picture that's a bit bleak, the thing that's really cool about Future Healthy Countdown is that we're aiming to drive accountability here to really drive policy change as well. And so we don't just stop at this research. We want to go into the policies that can actually shift change, and also acknowledge that our often siloed approaches aren't working, and that we all need to actually come together to drive change, whether that's government, whether that's organizations, individuals, civil society organizations, or grassroots community groups as well. All of us are part of this picture to turning things around. I'll go to the next slide. So just to give you a little spotlight into the domain of focus that's also in our supplement for this year, that's learning and employment pathways. So this is just taken out from that big picture that you saw. This year we deep dive into the learning and employment pathways domain. And we particularly with this domain and the measures that were developed here wanted to focus on equity. So high-level indicators that focus on equity, but we know that they're not as fully comprehensive, which is consistent across all of the domains. But equity is an underlying principle in the Future Healthy Countdown progress report. And as you can see here, currently only 1.4% of public schools are funded to the bare minimum of the school resource standard. Disadvantage still continues to be highly concentrated in schools, and the equity gap has remained or worsened. We know that education is a stepping stone to setting children and young people up to lead healthy lives. And right now, the playing field is not equitable, and we know that that comes with dire consequences when we don't address that. There's a lot of red and amber squares, and despite our best maps and efforts and all of the amazing work that people are doing, the terrain is clearly a bit tough. But we didn't want these to just be numbers that we show you that are pushing against our efforts. We actually wanted to show this image because we can actually build collective action together to change this into the green. But we know that data alone doesn't only shape hearts and minds. So moving the needle on these measures and others is where our policy actions come in, because we don't want this story to stay in the negative. There is an opportunity. So let's go into the next slide so I can show you what we've proposed. Thanks, Sarah. Amazing. So here are the 8 policy actions that form part of the platform for change that the Future Healthy Countdown has been proposing since 2023. What's really cool about each of these policy actions, we have 8 policy actions, as I mentioned. So 1 is overarching, and then we've got the 7 underneath, so 1 per domain. Each of these policy actions are feasible, firstly, immediately implementable, and also supported by evidence and capable of making system level change now, which is why they were chosen. Again, we focused on that system level because that's where we felt really the needle, if we shift the needle there, we'd see outcomes positively change for children and young people. When you bring them all together, they paint and create a blueprint for government action and collective action to achieve measurable improvements by 2030. And this really is building upon also other amazing work that's happening in this space too. Our role with the results of the progress report, as well as the policy actions, is to really amplify the existing advocacy efforts and bring research to the forefront as well. If we can go to the next slide as well, we added something a bit different to our progress report too, which is really cool and quite novel as well. So to further drive the momentum for policy change, we added an additional feature to the progress report, and that was the community sentiment mapping towards our policy actions. Why we did this is because we wanted to actually gauge what the support and the opposition for our 8 policy actions were. And as you can see on the screen, here are those prompts. They differ just a little bit slightly in wording to what the full policy action is, but that was just to make sure that we could phrase this in a way where people can answer, do they support, do they oppose? And here's what we found. We can go to the next slide to show what the results were. And there's a lot of green on this graph, which is great for us. We can see that there is appetite for change and a lot of support for the policy actions that the Future Healthy Countdown has proposed. On this graph that you can see here, 6 out of the 8 had support above 70%, which is quite high. And the strongest public support emerged around learning and employment pathways and the Future Generations policy action, which is our overarching policy action. So that really goes to show that there's clear momentum to bridge the divide between health and education. And I will say that divide is quite an unnatural divide. People do want to see some action there. Backing was mixed for ending fossil fuel projects, as well as lowering or extending the voting age to 16 and 17-year-olds. But what this full picture shows is that Australians are eager to see there be action and there be solutions taken up. What's really striking as well from the results, though, is that it also demonstrates a disconnect between current policy and programs for children and young people and what the public actually wants to see implemented. So we've also created a map that allows you to actually see this picture at the electorate level, which we can show you a visualization on the next slide of what this looks like. So when you head to our website, you'll actually be able to see the level of support. This is a snapshot of the learning and employment pathways policy support across electoral divisions. So you can actually go down to your specific electorate and see the level of support there. With the overwhelming support for learning and employment pathways, it's a little bit funny that we almost predicted in a way this domain as a focus for 2025, but really does again underscore that there's a lot of support here for education as a foundational pillar to improving health and well-being for children and young people. As this map shows, there's a lot of that deeper turquoise color, which shows that the support is quite high for reform in this area. So again, you can go to the website to actually play around and have a look to see where the support lies, and that goes for all of the 8 policy actions. If we can go to the next slide, please. We also have inbuilt an opportunity on our website as well for you to have a say. And you can actually do this right now while the webinar is happening. So if you scan the QR code, or there should be a link that's provided into the chat as well. There is a Mentimeter poll. If people aren't familiar with Mentimeter, it's a cool platform where you can engage to gauge support, ask questions, see what the kind of broader understanding around different questions or prompts are. And here we've provided a prompt around what you see as the top 3 policy actions that would improve children and young people's health and well-being now. So you can provide your thoughts to this, and the live results will be available on the website live for you to actually see what people have shared. But just to kind of round up, in terms of my own reflections for this progress report, it really paints a picture of how we can actually mobilize together around policy change. It really shows the importance of public awareness raising. So in terms of that momentum building, that people have an appetite to see reform, but also underscores why coalition building is so foundational to making sure that we come together to really drive the efforts collectively across research, across policy, across advocacy, because that's how we will see measurable change for children and young people. And it's what they're also asking for day in and day out as well. So with that being said, I'm going to pass over to another amazing young person, Planning Saw, who's going to provide his own reflections on this work, as well as how you can get further involved.
Thank you so much, Angelica. So the Future Healthy Countdown has come a really long way. So I was very lucky last year during World Children's Day, we launched the participation supplement at Parliament House. And that was where Dr. Monique Ryan and some of Australia's leading young voices was able to call on the federal government to extend the compulsory voting age to 16. And that response was significant. There was we chat to several MPs from all major parties to discuss the policy action, and we've had 11 organizations that publicly back this change as well. So my personal reflection is that since coming to Australia about 10 years ago, I've experienced navigating the education and the health systems. And as a young person myself, I've tried to innovate, and whether that's through co-founding a youth charity or whether that's through volunteering, there is so much energy with regards to young people hoping to support other young people. And over the past 2 years, being part of this Future Healthy Countdown working group, I've had the chance to collaborate, but more importantly, also challenge how we include young people in decision making. And I think it's a really great space that we have leaders like Anna, like Prue, and Sharon, because they listen. They embrace the idea that young people deserve that active role at the highest level to create the change that we want to see. And so right now, young people are co-leading entire research papers, including work on economic and commercial determinants of health. And young people in these groups are being valued not just as short-term contributors, but more as long-term partners and mentees. And hopefully this is building not the future generation, but the now current generation of research and policy leaders. So for myself, I'm still a little baby in this world of policy translation. But I think the message that I've learned is that the key answers are already there. Different people, different organizations, they hold different pieces. And what's really important is that we have that synergy and bringing together that collective voice. And so that brings me to how you can be part of this movement. So firstly, sharing the message. So we'll be sharing social media tiles after this session. So whether that's to a friend, a colleague, or an organization, that ripple would really matter. And secondly, emailing your local MPs. And so on our website, we've made a pre-filled template, and that features the 8 Future Healthy Countdown policy actions, and with a link to the tracker as well. So every message would then build that momentum for practical evidence-based reforms. And if you're representing an organization, whether that's a health service, advocacy group, a research institution, or a community organization, we want you in this coalition. And so organizations can join the countdown by adding their logo, and you can choose to support the full suite of the 8 policy actions or specific actions that align with your mission. And so what I really hope is that we could have this coalition of advocates, of organizations that can really support one another in this policy and practice. Because at the end of the day, we share this common goal. I'm hoping for a healthier and a more fairer future, one that not only thinks of young people, but actually actively works with them. So I'd like to pass it on to Professor Sharon to build this momentum.
Thank you so much, Planning, and it's a real honour, isn't it, to be able to have young people join us in this webinar, but also in our whole Healthy Future journey. And I've certainly learned a lot having young people around the table. If you want to hold yourself accountable, do work with young people. They certainly make you realise what's actually needed. So I think what we're going to do now, if I'm right, is that we're going to have a chance to have a little bit of a panel. That'll be with Planning and Parsi and Kate. But I thought I'd just share a few reflections with you first. And it's an extraordinary thing to be part of this Healthy Future Countdown on a number of levels. And I just want to sort of lay some of them out. First of all, the fact that we have this partnership across 3 extraordinary organisations working together to think about children's and young people's health development and wellbeing, and across all of those domains. So that's the first thing. That's kind of a big deal. The second big deal is the partnership with the Medical Journal of Australia. Now, those of you who would know about the MJA know it is pretty medical, and so it's pretty exciting, and I think forward thinking of the journal to be able to say we're going to look quite broadly and understand that the health of children and young people is determined by a whole range of factors, much of which are outside health itself. And so I keep telling people what a wild thing it is that the MJA has actually got this edition dedicated to research on education and pathways to employment. Like, that's pretty wild, right? That MJA is doing that as their kind of main research series. And I think, Angelica sort of touched on this unnatural divide we have between health and education, as if they're sort of somehow discrete entities that influence children in some sort of separate ways. But of course, we know that how children do in school determines their health. We know that their health determines how they're doing in school. And so it's really in all of our interests to work out how those things all work together. The other thing I just want to reflect on and just build on what Angelica said is that all of these different domains by default mean that there's a whole series of accountabilities that need to be brought to bear. And I'm going to throw to Kate in a minute to talk to some of those. But I just want to put on the table that these accountabilities go across governments. They go across the not-for-profit sector. They go across our relationships with business and the commercial entities. And it also goes across bringing young people themselves to the table and the joint accountability. Because, if these policy asks were easy, they would have been done by now. Nobody is sitting there going, we don't care about children, we don't care about young people, let's just ignore all of this. Actually, everybody you speak to is totally committed to improving the health and well-being of Australia's children and young people, even though, and you can see by the data that Angelica shared with you, we have actually failed pretty badly. And the solution isn't going to be, well, here's just the one silver bullet and off we go. But these policy levers suggest that amongst us, we might be able to do better. And I don't think it's in the bailiwick of any single one. It's not in the bailiwick only of federal government. It's not in the bailiwick only of state and federal governments. It's not in the bailiwick only of our business partners or our not-for-profits or our young people. But maybe collectively, we can start thinking more systematically about how we make a difference to children and young people. So I'm going to throw to these guys, but I do want to say this is not about trying to bash people up. It's actually the opposite. It's trying to put wind underneath everybody's wings so that you feel like that there is a collective effort, that people are listening, that there are data that tell us we're not doing so great and solutions that might help us. So I'm hoping that you're seeing Healthy Future 2030 as a wind under the wings kind of opportunity for us to make a difference for children in Australia, because of course, as a rich country, that's exactly what we should be doing. So perhaps on that note, Kate, I'm going to go to you first and ask you the first question. And it's building on this idea of kind of collective accountability. And just it's very interesting, for the first time, we've got these public sentiment approaches to the policies, which I think is fantastic, because you sort of get a sense of there's a appetite from the public to make a change. How do you think we utilise those and think across all the collaborations that we might need to actually make a difference over the next 5 years if we're going to deliver on our 2030 aspirations?
Yeah, thanks, Sharon, and thanks everyone. This has just been a delight to listen to where we're up to. So I guess the first thing is advocacy. So coming together, working together, breaking down silos, and seeing solutions as going across different portfolios, across business, as you've just mentioned. So I think education is the perfect example. So schools have such an opportunity for health and well-being as well. So I think that's a really great example. The hook for accountability is something that we need to drive and we need to keep pushing for. I think about my career in public health for the last 20 years, and as you've said, we've really failed to shift the needle on some of those areas, particularly, childhood obesity, and mental health, for instance. So I think one of the things we've been really conscious of in the countdown is actually what are the ways we could drive that accountability? And that's why our overarching policy action is for a Future Generations Commission. So we've worked heavily with Foundations for Tomorrow and the team leading that. And I think that's one example of where we could have a legislative hook that could drive change. If we keep measuring these things, that's not going to change it. It's great. We need the data. We need to be measuring it, but we also need to be pushing and ensuring that solutions actually happen. So I think that's where Future Healthy Countdown can come together and build that collective action, particularly with the voices of children and young people.
So much, Kate. And I think the Future Generations Commission is really interesting. We've obviously had the, Anne Hollins, who's the recent Children's Commissioner, talk about a Minister for Children. But I think this idea of a Future Generations Commission is so interesting because it really says who's going to sort of think about what's going to happen for the next generation, and absolutely aligns with the government's intergenerational report that really did outline things are pretty dire for our country if we don't start to do something. So on that note, Pasi, what is clearly fundamental to all of this is education and schooling, and we've had pretty inequitable results for quite some time in our academic results, and you see that in the and the actual results we've got there. So we've got we've got funding opportunities and we've got inequitable results, but of course it's more complex than all of that. And I wondered if you might just share your thinking. You've been in this area for so long, and where we should think about going to next.
Yeah, thank you, Sharon. It's wonderful to be part of this panel. Yeah, obviously, equity in education is the big question here, just like you mentioned. And when we think about equity in education or health, I think the equity of outcomes is a particularly important part of this. I would actually see two aspects in this question, that why the focus and sharper focus on equity in education and health is so important. The first one is clearly it's a moral issue, the moral imperative that we have. We have made a number of promises in education. For example, the most recent one is what we know as Alice Springs Education Declaration, that very clearly says that every child in Australia deserves not only equal access to high quality education and schooling, but that every school is a good school, that children should not be put in a place of their parents where they have to choose the school. So this moral aspect is one. Then the other one is what I would call a quality imperative, that we do know from evidence around the world that the equity and systems quality, or excellence, if you wish, go hand in hand. So it's not either or issue, that we would need to decide whether we want to have a high quality outcomes or excellence in education or health, or whether we would have a kind of equal systems. We do know that both of these things, equity and excellence, can go hand in hand, and that's why it's so important to be smarter, not only harder, but smarter in investing and thinking about the equity in education. And this is exactly what this piece of work that we've been doing here tries to advocate.
Thanks so much, Pasi, and probably a good segue from that in terms of the advocacy story is sort of thrown to you, Planning, because we've put a lot on the shoulders of young people from an advocacy point of view. But have you got some specific things that you might have been thinking about in terms of how services and how the kind of spaces that might bring young people together, how they might evolve to be able to really meet the needs of young people?
Yeah, thank you, Sharon. And I think I'll just start off by saying that, I'm but one young person who tries my best to see what's in the spaces, and there are many incredible youth organizations that do incredible consultations and active partnerships with young people. What I'll say is that I think that young people, we need universal prevention and early intervention services. and not just crisis interventions. So I'll also say that the supplement has 6 incredible articles, which illustrates a lot of these points. And just to pick up from that, the countdown report, the progress report, it shows that maternal deprivation increased by up to 7% from 2023 to 2024. Developmental vulnerability has reached its highest ever. And so we need services that are genuinely youth-friendly. We need services that are culturally appropriate, that is easy to navigate for young people, and that so that they can maintain an optimal level of well-being, social connection, and greater confidence and assurance across their adolescence. The second point I want to say is that we need full service schools which can integrate things like health, education, and social support. And that's because I believe that it's that holistic combination of services where, as a young person, you spend a full work day across in schools. And while that load is, it's a balance between parents and schools, but there's no denying that the school environment is one that is able to best foster that development as well. In terms of funding, I think one interesting finding I saw from Professor Parsi's paper was with regards to public school funding. And that's that the Australian government has committed to ensuring that all public schools receive 100% of their schooling resource standards. But the catch is that a lot of the funding is backloaded towards the 2030 and 2034. So I think it's really important that we need to roll it out sooner. We also need to make sure that it has equity in focus, that is prioritized towards schools of the highest disadvantage. I personally came from a public schooling system, and so I really appreciate the diversity. I appreciate the points that Professor Parsi made, that education should be something that that it is you hope that you don't get to pick the places that we are born from, but we get to thrive regardless of where we've come from.
Thanks so much, Planning. And can I say, but for a different webinar, that Hazi and I have been colluding quite a bit on this idea of reinventing Australian schools to exactly think about your points, Planning, which is to really sort of say what would schools look like if they could better meet children's health development, learning and well-being. So if anyone's interested, have a look at that sort of work. But it's exactly to your point, which is to maximise the opportunities that schools provide as the kind of single most important universal platform for children and young people. So maybe that's for a different time. But maybe I'll also I'm going to go to you for a moment, Kate, and some of the questions that have come through are just really asking whether or not we think there is room for other metrics in our kind of healthy future work. And two of them being put on the table is food security and oral health. And I think reminded everybody that our next supplement is actually focused on health. I'm particularly have an unnatural obsession with oral health, but it isn't actually in the supplement. But Kate, tell us a little bit about the process we went through and how we landed on what we landed on. Because I think there'll be a whole range of things that we could actually report on, remembering the AHW does some of this as well. But Kate, what are your thoughts about that?
Yeah, it's a great point. I mean, it took us, Future Healthy Countdown, this is our 3rd year. And in the 2nd year, we built the consensus statement. And it was a lot of work bringing a lot of people together with a lot of different views. I often talk in the child health indicator space that people have their pet indicator. And I have mine, some of which didn't make it in. So this was done by a consensus statement with people from across different organisations. We had young people, public health experts, clinicians, and policy people, all within that consensus building framework. And there was a lot of time and effort that went into it. The measures were chosen that had national coverage. A lot of them we can't break down to the local government or the state level even on some of them. So it really did highlight a dearth of data. So I think adding extra measures, I'm not sure that's something we'll do, but we absolutely have a great opportunity to spotlight those areas in the supplement. So as Sharon mentioned, next year will be on healthy, and there's a range of great papers that will spotlight health across different aspects and policy and practice that can drive change. A really big component of Future Healthy Countdown is really trying to shine a light on things that we can do to drive change rather than just reporting the evidence, but actually the policy and practice change that would make a difference alongside those measures. So yeah, you can also read the consensus statement in last year's supplement if you want to look at any of that process on how we derive the measures.
And Kate, maybe while you've got the floor for just a moment, do you want to just give a brief summary of what's in the MJA in terms of the papers, and then maybe we can throw to Parsi and planning to sort of give a bit more colour and movement to that, because there's quite a few questions coming through around some of the educational and school-based kind of work. So there's just this opportunity to sort of really just shine a bit more of a spotlight on what we've actually put into the MJA this year.
Yeah, so this year's supplement, so the first paper is led by Parsi and Trevor Copland, and I probably shouldn't have started putting the authors to these because I'll forget them. So, but the first paper is really looking at funding and how changing funding would really improve outcomes, but not just funding, actually what you do with that funding. Sorry, Parsi, you probably do a better job of that. But once they have the money, actually, what are the best ways to spend that would improve health and wellbeing? The next one is from Generation Victoria, and that looks at early childhood and how research and studies like Origin and Gen V can drive change. Then we have Pip Collins and the team from Learning Creates, amazing paper, actually led by young people, and that one really around how education needs to be changing to cater for children and young people, and it's not just school, also outside of school in those early years, early adulthood. And then we have Hayley, I'm going to forget her name, sorry, but Hayley and Melinda Mann's paper, and that's an purely Indigenous led paper, and that looks at changing learning environments to ensure that they deliver for children and young people and ensuring they're culturally appropriate. So it's a really great supplement, and a lot of young people are involved in Hayley Maguire's paper too, and it's just great to see young people leading these papers.
Yeah, thanks, Kate. I think it was just nice for the audience to get a sense of what's in there because they're really kind of interesting. So I might actually go to you, Planning, because just for a moment, what do you think about this process? And, we're trying to bring young people's voice to the table. Do you think this approach to having the research papers in the actual MJA and our paper focusing on education, how do you feel as a young person being part of that process in terms of making a difference, both from a point of view and also from an outcome point of view?
Yeah. So I think in a broader sense, and that includes with regards to research, I think that there are different levels of youth engagement. And Vic Health has an incredible kind of youth engagement framework, which pinpoints the different various activities which organizations can do and what kind of level of youth engagement that corresponds to. In Future Healthy Countdown, I'm lucky to be part of that working group committee. I'm grateful to also be able to help out with some of the research. And that has introduced, I would say, power dynamics that is not very conventional or not very traditional, where traditionally I think young people would, they wouldn't get a seat on the table, or they would have a minimum seat where most of the decision making and government's process would have already been made before it's been, I guess, for final proof checking by the young people, where there might be, again, limited scope then for any changes. And I think then being part of the governance process, I don't deny, I think that it's probably an uneasy new feeling, especially for people that are seen to be or known to be experts within their field, but it's also then recognizing the lived experience of young people and seeing how we can best meander and navigate that. And rather than it being an adversary space, rather it is about having that shared vision. It's about collaboration. It's also recognizing that young people now have a really active platform. And I've seen some of the questions about social media, which Professor Pasi might be able to add on to as well. But the spaces for young people to speak and to be active on has been really galvanized by social media. And so it's really important to include evidence-based policies and practices and advice from experts, as well as young people live experience, and find a good middle ground that we can communicate meaningful findings from.
Thank you so much, Planning. And I think that's a really good segue for me to bring it back to Pasi, who's going to have all the answers. But I think, Pasi, there's quite a few questions that have come through, and I'm just summarising them. So we're really grateful for your questions. They're kind of converging actually about, I'm interpreting as kind of partnership issues, in particular with young people and with families, like what's the role of school in that? There's some questions coming through around kind of digital wellbeing and mental health. And there's questions coming through about whether our current funding systems are just fundamentally inequitable through public, private, etc. So I don't quite know how they all converge. They certainly converge in this idea of rethinking what and reinventing what schools might be like. But can you have a think? I'd love your thoughts on how we do think better about how we're partnering with young people and families, how we're considering the mental health of young people and schools, and how we fundamentally have the opportunity to make a difference into the future in about 2 minutes. No, you can have 3.
Oh, Sharon, you give me a really hard one. This is a big question. But let me. Yeah, let me start by saying that planning, it's wonderful to have your voice here in this conversation. I think this is exactly what we need to do. But I think you know, traditionally the schools everywhere, but particularly here in Australia, is still seen primarily as places where young people go from Monday to Friday, and then they are taught things that often adults and some other people outside of the school think are important for young people to learn. And I think as long as we continue thinking about school as primarily a place for young people to be kind of taught and told what they need to know in the future, we're going to have a hard time to see anything else and any better outcomes that we are seeing right now. So that's why it's so important not only to give young people voice. I think it's very important that we listen to young people, what they want, and listen to their views in schools as well. But I think we need to move from this voice gradually to agency. And agency means that we will help young people to take the ownership and leadership in leading some of these things that happen in the school. And one of these papers, if you read the supplements articles, there's information and evidence there showing that young people here in Australia don't really value that much the old school model anymore, where they are told what they need to learn, but they expect much more personalized or individualized action in a school where they can follow their own passions and where they are able to do things that are meaningful for them. And I think that I see this student agency also as a bridge to the further community and families and others. And that's why I think, Sharon, when we are talking about this reinventing Australian schools, this stronger agency, and thinking kind of harder about this, what the agency would look like when students are really invited to take the role of active co-creators and co-designers of school, not just the audience where we ask whether you like something or not. So I can see these things happening in many Australian schools in all states and territories here, but I think that this is one of those things where we need to probably spend more time to think how we move from this age of achievement and focusing on only delivering and doing things to agency and autonomy, both at the level of young people and teachers as well in schools.
You're absolutely right, Pasi, and there's also some questions that have been coming on the role of parents. And I think we would all agree that we would see them as really important, and community actually as being really important partners. And we've been doing some work on children who are attending schools where there are very disengaged children. And one of the key partners in all of that is the voice of the parent as well as the voice of the young person. So so that comment's, you know, well made in terms of how do you bring all these voices together. Kate, I want to go to you for the last question, just to sort of lean into this idea of how we've considered equity in the MJA supplement. In particular, we've been trying to think about how we think about these data and how we think about the supplement and the advocacy in terms of First Nations people, but also we've been thinking about it in terms of other priority groups such as children and young people and their families living in rural and remote areas. So we've really, I think, tried to think about, I'm not sure we've nailed it, but we've at least tried to think about that equity lens. Do you want to talk a little bit about that, about some of our findings and some of our work going forward?
Yeah, so it's underpinned everything since the day Future Healthy Countdown started to ensure that we're highlighting the issues and the solutions that are available for people in those priority populations. So Hayley Maguire's paper this year, actually, I didn't give that a big enough plug. It's a new charter for Indigenous learning, and that is like a prime example. So each year we have committed to an entirely Indigenous-led paper around solutions. So that will happen in every supplement going forward. And we've had Indigenous groups involved and people involved in the design of the progress report, the measures, and the policy actions. When we were choosing the policy actions, at the heart of the decision, it was policy actions that were systems focused, things that weren't putting the blame back on individuals. So that drove the 8 policy actions that you see, and I think that's fundamental. So I think in the obesity space, for instance, the policy action there wasn't about exercise or diet in terms of, you know, interventions to increase exercise and things like that. They're incredibly important and need to happen, but we chose actually the systems level to legislate an immediate ban for harmful marketing to children and young people for that reason. So yeah, absolutely, and we'll continue to ensure that priority populations are front and center of the countdown as we go forward, because if we need to move the needle anywhere, it's that area first, and for those young people.
Yeah, thanks for that. No, thank you very much. Adam's just put into the chat for those who are interested the paper by Hayley and Melinda, so you can click on that. Planning, I'm going to give you the last word because I think young people should get the last word. And just a sense from you, maybe just kind of wrap up sense. There's been quite a lot of comments around young people's mental health and how that kind of works in terms of this current sort of focus we've got on education and pathways to employment. Do you have some thoughts about that, about how we might bring explicitly mental health and wellbeing, digital wellbeing maybe, and schools together in a way that, as a young person, you see as a way forward?
Yeah. So I've had a lot of conversations with, you know, my peers. I've just been having nephews that are just starting primary schools as well, so I've just been interacting with them as well. I would say that the landscape broadly is very dynamic. You know, things are changing so quickly. You know, social media 10 years ago is changing so fast to now. I'm barely understanding the language that my nephews are talking to me about. And that's where we can either choose to stay stagnant and, you know, let the social media algorithms kind of blizz us apart, causing this, what I feel is really essential, intergenerational connection that what I feel so personally connected to is that storytelling that goes from grandparents to parents to children. And I think it's such a unfortunate outcome that a lot of families right now, they feel disconnected to their children, partly due to social media. And I think that's where education curriculums needs to be dynamic, not only in terms of how we are able to shape young people's understanding of social media, but also in terms of how parents and children can be, jointly protected from what they perceive or what is perceived as harm and what isn't perceived as harm. My last plug would be I really believe in this paper. I believe in this supplement. I believe in this countdown. And I realize now that research and policies mean very little without momentum. And so I'm really hoping that individuals, organizations can keep joining this, and I want to create something that's very radical by the end of 2030.
Well, I don't think there's anything more we can possibly say after that. I don't think I discount research and policy altogether. However, necessary but not sufficient, exactly as you say, planning, and we need the rest. So on that note, I just want to thank all three of you for joining us this morning and hand back to Prue to see us out.
Thank you, Sharon, and thank you all so much. What a fantastic conversation. I want to remind all of you that you can see the results of the Mentimeter in our website now. If you haven't completed it and you're really desperate to have some input around what you think the top 3 Future Healthy Countdown priorities should be, please do that, and the link will be put into the chat. I want to thank Anna, Angelica, Planning, Sharon, Kate and Parsi for their wonderful conversation. Please stay engaged with Future Healthy Countdown. There's a fantastic website that you can access that shows some of the measures that we've talked through today. And I just want to finish up on Planning's challenge to us that he would like some radical solutions by the end of 2030. So how are we working with children and young people, genuinely hearing their voices, giving them agency around what their future is going to look like, what their Future Healthy Countdown 2030 will look like? Thank you all very much and enjoy the rest of your day.